As we approach the end of life, we want control, respect and dignity. Holistic assessment will help to achieve this. In this film, we'll meet two people at the end of life who've benefited from holistic assessment and person-centred care.
When we're thinking about holistic assessment, holistic care, there's sort of four key things really, four themes, which is physical aspects of somebody's care, social components of their care, the psychological part, and also spiritual care.
All four themes are handled at St Joseph's Hospice in East London, which provides palliative care for people with life-limiting conditions. Diane Laverty, the nurse consultant in palliative care, takes the lead in the holistic assessment of those at the end of life.
I think for me, in a nutshell, holistic assessment is literally the patient telling me what I need to know about them as a person and the life they're leading at the moment in order to take the best care of them possible.
This philosophy is at the heart of all good end-of-life care. It's exemplified at St Joseph's Hospice and in many other services around the country.
Well, not too bad, actually.
Today, Diane is with Cecilia, who has a chronic illness.
It catches up on me sometimes. It's like it creeps up from behind.
Diane is reassured that Cecilia's physical and social care needs are met with help from the hospice. And she also chats to her about her spiritual care.
The Sisters of Mercy at our parish, and they come and visit me. And when I can't get to church, they come up. Yeah, Sister Esther comes regular.
And will they give you Mass at home?
They give me communion.
Communion.
Yeah, yeah.
Dr. Kate Crossland, who works at the hospice, is helping Cecilia develop her end-of-life care plan, something which all the professionals involved will refer to. Cecilia has firm views about how she'd like things handled.
Take me through what you've decided, because you said you're quite set in your decisions and what you do and what you don't want done.
I don't want to be resuscitated. And I do not, under any circumstances, want to go on a life support machine.
Cecilia's wishes were formed when her father and brother died of the same disease. Close relatives had been involved in difficult decisions to switch off life support machines.
Because the three of us have suffered with the same illness, I didn't want to have the same pressure left on my children that was left on my family when my brother died. Yes, he went on a life support machine. I didn't think I wanted that for myself. And I didn't want to have to leave the responsibility to my children, to have to make that decision. I thought it might be helpful if I made the decision myself while I'm of sound mind. It is important to get it right, because with death and the journey towards end-of-life care, you only get one chance at it. You don't get a repeat performance. So it's incredibly important to make sure that you're hearing what the patient says and the family, and how you can be involved and support them in the best way possible.
Cecilia's wish not to be resuscitated as part of her advanced care plan is discussed at a weekly multidisciplinary meeting. It's important that all involved know what Cecilia wants and how these wishes affect her immediate family.
One of the things we were talking with her about today was advanced care planning, which we'd sort of taken forward from when she was last in. She wanted to talk to all of her boys together, which she's done, and she was telling me that Carl and the youngest son were quite upset during that conversation, found it quite difficult.
I spoke with my sons. At first it was a bit difficult because they didn't quite understand what it was I was trying to tell them and what it was I wanted to do. They misunderstood.
It may also be then that Carl might want to talk to somebody separately, you know, to get support for him, because quite often patients have lots and lots of people, don't they, visiting them and supporting them, and it's the carer who's actually struggling with all of that. So, okay.
The social work component
is incredibly important because it covers so many spheres. So it talks about the family, it talks about the patient, and it also talks about the rippling effects of all of that outside of the illness and the impact it's having on the family.
For Cecilia, the holistic assessment at St Joseph's has provided her with a clear path to the end of life.
It was a bit like a veil being lifted, and you see there's light at the end of the tunnel. The people here, the staff, the nurses here, their whole attitude to me and the people here was so much different to what I'd experienced in the past.
Every professional in health and social care should be assessing holistically. A holistic assessment isn't a one-off event. It's not something that just happens at one point in somebody's journey in end-of-life care. There's going to be, different times that they're going to do that. So it might be holistic assessment would be important when somebody's first diagnosed, or when their diagnosis changes from cure to terminal, or when there's any significant changes.
Some people at the end of life need to take holistic assessment at their own pace. Senior social worker Maggie Allingham-Hodge experienced this caring for Janet, who's at the end stage of a chronic respiratory disease.
You're looking a lot better.
Oh, thank you very
When I
much.
first knew Janet, she was very, very reclusive, very quiet, found it difficult to talk and really difficult to trust people. She'd had lost her husband and her son the year previously within 6 months of each other, and had become very withdrawn and isolated.
I was just thinking, how long you and I have known each other. It must be coming up for 18 months.
Yes, it must be.
And what a journey that's been.
Oh, hasn't it? Yeah.
And how when you think about it, starting off with your difficult, you were finding it difficult to manage.
I was.
I think the important thing about helping Janet was to go at her pace. It was very important that we didn't rush her, that we didn't talk about issues that she wasn't ready to talk about. And it was really building up trust. And for some people, the idea of hospice means the end of my life, and that's something they can't contemplate. So it was really helping her to see what the hospice could offer her.
I do remember last Christmas
Last Christmas wasn't a
how poorly you were.
occasion, no.
Yeah, you had a very nasty infection, and
I
in
did.
fact, it was a bit scary,
Very
wasn't it?
Scary, yes.
Last Christmas was a difficult one for her. She came into the hospice and was experiencing a lot of symptoms. Her health had deteriorated. She got a chest infection, and over just literally prior to Christmas, she began to panic that her life was in fact coming to an end. And 2 or 3 days before Christmas, we arranged for her to see a solicitor, and on Christmas Eve managed to make her will and begin to sort out her affairs. And that was a real breakthrough for her. Having had a double bereavement, it wasn't a place that she could go to before that. And in fact, she recovered and was discharged home early in the new year. And her life during the last 12 months has really picked up.
But that sudden worsening in Janet's health meant she was able to recognise the need to take control of her own end of life. And Maggie and the team at the hospice found Janet was more receptive to the services on offer.
You know now that that's sorted.
That's sorted, and I can change it if I need be in the future.
Absolutely. And actually, I think, building up to that, Janet, what you were worried about was even talking about those kind of things.
Yeah.
Because it was too difficult.
Very emotional, because I'm very emotional at the time, whereas now it's a lot easier.
Yeah.
We're all individuals, and what's important to us in life and when we're dying will be very individual as well. The important thing about having a good death is talking to patients and families about what a good death might be, so that we can prepare for that, and that we can help them achieve their good death, whatever that means.
It means to me a great deal, because before I didn't know who to turn to other than my own GP.
If need be, I can phone St Joe's, and there's always somebody here I can talk to, whether it be day or night. And I really feel that's an advantage for people like me.
I now know there is somebody in the hospice, in any department, who can help me. And I don't feel so alone.